Thank you for joining us today and welcome. My name is Julian Pearce, Program Manager of Economic Opportunity at Fairfield County's Community Foundation. Throughout 2018, we're pleased to host a series of community conversation webinars to spark discussions about topics and issues impacting Fairfield County. For over 25 years, Fairfield County's Community Foundation has been working to ensure that every individual in our region has the opportunity to thrive. To create lasting change in Fairfield County, we bring together bright minds, bold leaders, and trusted resources. As a philanthropic advisor, the Community Foundation manages close to 600 charitable funds. As a grant maker, we've provided over $200 million in support of the nonprofit sector. And as a community partner, we unite people and resources to address closing the opportunity gap across the 23 towns and cities in Fairfield County. We can't do this work without the support of all of our partners, donors, nonprofits, elected officials, and other philanthropic organizations. We've got quite a crew here today, and I am very pleased to be joined by Dr. Monette Ferguson, Acting Executive Director of ABCD, Betsy Cronin, Director of Housing Development at The Connection, Dr. Ann Farrell, Director of Research at Chapin Hall at the University of Chicago, and Dr. Melissa Cole, Researcher at Chapin Hall at the University of Chicago. Before we get started, I want to take care of some housekeeping. We do want this to be an interactive discussion, so we invite you to submit questions in the chat box that you should find on the right-hand side of your screen. Please contribute your questions at any time. If you don't see the chat box, click on the small orange arrow at the top right-hand corner. We have a few questions to start the conversation, so let's get going. First off, Dr. Ferguson, please tell us more about how this partnership supporting Bridgeport families came to be.
Good afternoon. Thank you for having me. First off, ABCD is a 54-year-old CAP agency serving over 35 families and individuals annually in the Fairfield County, Norwalk, and Westport area. Specifically, the Early Learning Division provides provides quality early learning experiences for about 1,000 families for children birth to 5 annually. In our 2017 Community Needs Assessment, homelessness emerged as one of the top 3 needs for our community, followed closely by employment and education. This, coupled with the anecdotal information we received regularly from our caseworkers about our families living in cars in uninhabitable areas and places, really provoked a duty and a responsibility for ABCD to do something about this issue. Specifically, we sought to find experts in this space. That brought us to the door of The Connection, whom at the time we cohabitated at one of our newer sites and shared space to provide resources for families there. In addition, they reached out to Chapin Hall at University of Chicago, and we put our heads together not only to figure out the breadth and the depth of the issue, but also figure out what strategic ways and research-based strategies we can put together to formulate a solution for our families.
Well, thank you, Dr. Ferguson. Moving on. This question is for Dr. Farrell. What is the Quick Risk and Assets for Family Triage tool?
Thank you. So a little bit of information here as background. There's been a supportive housing initiative in the state of Connecticut for quite a long time that was directed toward families in the child welfare system who are at risk for losing their children to foster care. And the Connection Incorporated and the State Child Welfare Agency, DCFS, asked us at the time I was at the University of Connecticut, I'm now at Chapin Hall at the University of Chicago, asked us to help build a measure that would help folks at the front end of the child welfare and housing system have an understanding of how deep the problems were that were facing individual families. So we created something called the Risks and Assets for Family Triage tool. And as you can see from this first slide, it's a rapid screener for family strengths and needs. And we developed and tested this in a really rigorous way across time. And we collected data with about more than 800 families in Connecticut, where we used a short version of the raft to do a quick triage to understand essentially their eligibility for a federally sponsored housing and child welfare demonstration project. So we shortened what was a much longer instrument that was a detailed assessment of family strengths and needs into a 3-item measure that looked at the family's current housing situation, the actual condition of their housing, and the family's history with respect to housing. And the history question largely tapped experiences of homelessness and housing instability that tell us a lot, because the literature has revealed that families who experience housing instability often move in and out of different forms of instability and homelessness, such that housing instability and homelessness are actually fluid, and family and child experiences of instability and homelessness tend to remain across time, but not remain the same across time. Next slide, please. So what we sought to do in our partnership in Bridgeport with ABCD was to take that 3-item screener, which did a really good job of predicting which families were going to have difficulty maintaining housing stability, and it did a really good job of sort of coinciding with other measures of difficulty in families. So we found that families who had housing instability, a history of housing instability, and poor housing conditions were families that were also likely to have a lot of other problems. And that was evident in the child welfare population. But as Dr. Ferguson has just suggested, there's a need and a concern, particularly as we understand the critical importance of early childhood, to screen for housing instability and homelessness among families who are experiencing poverty. And the Head Start population, by virtue of their financial eligibility, is a population of concern here. So we modified the 3-item raft that we had used in child welfare, and then we worked with our partners at the Connection and ABCD to add 7 additional items kind of back in, because we didn't want just a picture of housing. We wanted a picture that would give us a better understanding of how each family was doing all together. And on this slide, you'll see the 7 additional raft items listed. We also collected a little bit more of family demographic information so we could understand a little bit more about the population. And the form that we used was actually connected to the program manual at ABCD, such that the family services workers would fill out this 10-item screener and immediately be given feedback about any red flags that came through. So we designed this process as a team, and the intention was clearly to help family workers to understand family assets and needs very quickly, and also to help them connect families promptly to needed services. While we were doing all that, we were building a data set that we could analyze to understand the incidence and prevalence of housing instability and homelessness in this population, and begin to inform an intervention that we'll talk about in a little while. Next slide, and I'll pass to Melissa Culp.
Thanks so much, Anne. So as Anne mentioned, we have done a pilot study using the early childhood QRAF, and this first pass at understanding exactly how these elements play out for children in children's lives was conducted at the Action for Bridgeport Community Development Early Learning Division. This sample included almost 1,000 children, and this encompassed about 90% of the children who were enrolled at the 14 ABCD early learning sites. When we looked at the demographic breakdown of these families, we saw that the average household income was about $17,000, and nearly 20% of these families had no income whatsoever. When we looked at their eligibility for housing vouchers, we saw that almost 60% of families had met the preferred income eligibility level, which was 30% of the area median income. And then an additional 30% of families were eligible at the 50% AMI level. So these are the levels at which HUD deems families eligible for housing vouchers, with families earning 50% of the AMI considered to be low income or very low income, and families earning 30% of the area median income to be extremely low income. So you can see here that that about 87% of families were in fact meeting the eligibility criteria for a housing voucher. We also saw that about 8% of primary caregivers in these households had a bachelor's degree or higher, suggesting that these families were experiencing challenges related to their socioeconomic status. Next slide, please. So this slide demonstrates the study findings from our initial pilot study. And so as Anne mentioned, we administered the QRAP EC through staff at the ABCD early learning sites. So they were responsible for completing the QRAP for each of their families based on their understanding of what families were experiencing. And the QRAP was scored on a 0 to 4 scale. So for each of the housing indicators, looking at current housing, housing condition, and housing history, my apologies, we saw that about 49% of families had mild to moderate housing concerns, and about another half had no housing risk whatsoever. So those families who had no housing risk whatsoever were reported to be in safe, stable, and adequate housing. For these families, housing was in fact an asset. But for those families who were experiencing some mild to moderate housing concerns, these are families that scored at least a 2 or a 3 on this 5-point scale on any of the 3 housing questions. So this could indicate concerns around housing quality and maintenance. It could signify families living in unsafe neighborhoods or an experience with a past eviction. Meanwhile, families who were experiencing significant to severe housing concerns encompassed 4% of this population. So these are families who had at least a 3 or a 4 on one of the 3 housing questions. And that means these families were living in places that were unsheltered, they had 2 or more shelter stays, or they were experiencing chronic housing instability. So you can get a sense of the range of housing experiences that families participating in the ABCD early learning programs were experiencing. When we looked at families who had any housing risk, we saw that their experiences of housing concerns really did co-occur with some other experiences within the household. So as Anne mentioned, the QRAP EC had a number of different items that that captured the extent to which families were facing risks or had assets in other domains of family life. So some of those included parent health and well-being, income, education, and employment, parenting skills, and early childhood attendance. And we found that these indicators in particular really jumped out as co-occurring with housing risk. So you can see here in this figure on the right that we saw that parents who were reported to have chronic health problems were 4.2 times as likely to also experience some kind of housing risk. Similarly, with parents experiencing employment issues, meaning a lack of education or literacy or a lack of functional skills, these families were 3.6 times as likely to experience housing risk. And families with lower parenting skills, again, 3.6 times as likely to experience some housing risk. And children who had inconsistent Head Start attendance, meaning that they were missing at least 2 to 3 days per week, these families were also reported to experience mild to severe housing risk. So
Thank you, Dr. Cole. My apologies. Thank you, Dr. Cole, but we do have to move on. And we have to move on to our next question, which is how or what is the Homeworks program? And Betsy, I'll let you field that question.
Okay. Thanks, Julian. The Homeworks program is really a partnership. As Dr. Ferguson mentioned, we have a partnership between the early childhood at ABCD. We have a partnership with data and research evaluation with Chapin Hall, and we have the connection, provides the services, and has been doing a lot of supportive housing work for families, as Dr. Farrell had mentioned, for many years, actually 20 years. We've had our supportive housing for families program, a child welfare, family unification, family preservation supportive housing program. So we came together because we were actually doing work in Bridgeport, and we were doing work in the same location as ABCD Head Start, and we decided that we needed to do something about the issues, the housing instability and the housing issues that we had identified through that screening process using the QRAFT screening tool. So we developed our partnership. We call our partnership HomeWorks. It's actually the name of our program as well. And we have a new partner in this project, and that's the Fairfield County Community Foundation, and we're very grateful for that partnership as well. We also have a partnership with the Coordinated Access Network in Bridgeport that we've working closely with now to really coordinate with them around some of the housing resources that they have. So the purpose of the HomeWorks program is to ensure that homeless families with age-eligible children are successfully enrolled and engaged in ABCD early learning programs, as well as we want to make sure that those families are safely housed to ensure that the child and family stability, well-being, and educational success exists with those families. So we established as a first step, our partnership, our HomeWorks program has established and launched work with an early childhood family navigator, and they work directly with ABCD, the family workers there, and community partners to identify the families with young children and link them to the housing supports and other resources that will enhance self-sufficiency and long-term stability. They also act as a liaison with and support ABCD family workers around the housing issues. The Family Navigator currently works part-time, actually 1 day a week, so there's a lot of work involved in that 1 day a week, but she works directly with the folks at the Coordinated Access Network to secure housing resources for the ABCD homeless families that we've identified through the screening process using the QRAFT. Also, she's working directly with the CAN Coordinated Access Network folks to secure early learning resources for those homeless families. So for the homeless families that are on the CAN waiting list, our Family Navigator assists and facilitates enrollment for those age-eligible children in the early childhood programs at ABCD in Bridgeport. We're continuing, the Family Navigator also has worked and done some training, additional training with the family workers at ABCD to help them use the QRAFT screening tool, and helps with the referrals and care coordination to get those families that score in the high-risk, high-need housing domain onto the coordinated access networks to access those services that exist there. And do that follow-up with the family workers to make sure that those families get their appointments with the CAN network and get those families to a better place in terms of housing and accessing those housing resources. Currently, we're pursuing funding for a full-time pilot and program evaluation. Both those pieces are very important. We believe that we need to do further evaluation of the work that we're doing with the Family Navigator. And the Family Navigator is just one of many possible models, but we thought it was the first step and best step, really, to take a look at what's going on inside the different systems and to report out on that, to make a more informed decision on the next steps.
Thank you, Betsy. So we learned a lot about how this partnership came to be. We learned about the assessment tools used and the assessment of needs that led to the launch of this HomeWorks pilot program, and a bit about what's happening on the ground and your needs to ensure a successful program. So Dr. Ferguson, I must ask, what's next for the partnership?
Thank you, Julian. That's a great question. As we work together over time, I think we are really solidifying our relationship and our partnership with the connection and with Chapin Hall. The experts in both of these spaces, Dr. Farrell and Dr. Melissa, are doing an awesome job of helping us better understand this space. The connection doing an awesome job in helping our caseworkers and our families move through a complicated system with the use of the navigator. Continually looking for resources. Thanks to Fairfield County Foundation, we are thankful and grateful that they see the importance and the value in this work for our families, our low-income early childhood families in Fairfield County, specifically in the Bridgeport area. Our ongoing work includes continuing to collect data and having a secondary analysis of the QRAF. Also implementing, and as Betsy suggested, implementing different models, research-based models that may be more appropriate for us to move forward with success for our families and housing stability in this area. It's important that every step of this intervention is taken really looked at very specifically and very seriously, because we'd like to duplicate this model nationally. It's very important that Bridgeport and surrounding area families take advantage of what we learn, but we would like to learn national lessons from this pilot. So as we move forward, and we're very carefully documenting our what work strategies with our families, and also our what work strategies with meaningful partnerships. We cannot do this work alone. I think that was one of the first realizations that we came to very early in this work, is that ABCD is very good at many things, but there are partners that are great at other things. And we needed to draw them in and welcome them into the space so we could share our expertise and our lessons learned so we could have better outcomes for families. So with all that said, our next steps will be grounded in lessons learned and future success.
Speaking of lessons learned, we're now going to move to our Q&A. But first, just to stay on that topic, Dr. Ferguson, what are some of ABCD, the connection, and Chapin Hall's key takeaways and proposed action steps for promoting housing stability for low-income families with young children?
I think one of our major key takeaways was the power of relationships, the relationship between the caseworker, the bridge that the navigator can create, as well as the importance of open, honest communication between the family and the caseworker that can really facilitate the, again, no pun intended, connection to a healthy housing and stability for our families. Over and over again, we hear about how families feel safe in our facilities, and they build relationships with their caseworkers to really believe that they can help them in their situation and help them evolve out of the cycle of poverty, which is the mission of ABCD as a community action agency. So relationship building is a key takeaway. Good partnerships is a key takeaway as well. Every partner is not a good partner. Everybody who wants to sit around the table with you and discuss things is not worth your time or your energy when you have something so important and such a dire need that you need to resolve for families, as important as housing stability and wellness. So good partnerships, communication, and good relationships are key takeaways for us.
Betsy, please.
I think I totally agree with Dr. Ferguson about the relationship. Can't stress the importance of that. And also, I think what we've learned is that the family navigator, there's a lot of work involved in that early childhood family navigator with that position, because you're really bridging so many, systems, and you really want to do the intensive work to make sure that the family, the homeless family and their children get connected to the right resources. So it requires a lot of intensive case management, care coordination that we know we need to build into this program to make sure every family gets that there's a good follow through and every family gets to the right place and gets that housing that they need.
Thank you very much, both Dr. Ferguson and Betsy. I do want to remind everyone, if you do have questions, please use the chat function to ask them. We do have some great questions in, but we still have a few minutes of Q&A. So if you're curious about anything, now would be the time. The next question is for Betsy, I believe. What is the caseload of the Family Navigator?
Our early childhood family navigator, Emily Schreck, she has a caseload size of 52 families. She is working with 36 from the Coordinated Access Network. Those are the families who are on the they're on the homeless waiting list, the family homeless waiting list, and they have age-eligible children, and those families are being referred and enrolled in ABCD Head Start Early Learning Program. So there's 36 of those families that Emily's been working with intensively to enroll their children in the early learning, which is so important. And they're not always in shelters, so it's hard to access those families, but through, that intensive work, that intensive case management has to be built into this so that they do access those families. There has to be home visiting built into this and some real intensive work that we want to build into that step too. And then on the other end, there are 17 families that Emily has identified in terms of needing to be referred to the Coordinated Access Network for housing. So that's that other half of the caseload and the other half of the workload that needs to be done, bringing housing that already exists in the community to these families. One of the things that we're hoping to do is, create a diversion program so that we can directly serve those families without having to direct them to the homeless network. We'd like to take care of those families before we have to get them, before they have to be referred into a 211 system. We'd like to really divert them from that system so that we can launch them in a whole different direction in terms of family and housing stability.
So we are wrapping up Q&A, but I do want to give you at least a minute to address how you're going about securing funding for this pilot. And Dr. Ferguson, I'll let you start.
Thank you, Julian. So we have had an exciting 18 months since we've begun this project. I call them road shows. There have been opportunities that we've been able to take advantage of from any audience that we can get together, from OEC or the state of Connecticut to private funders and philanthropists to Fairfield County Foundation. We appreciate any audience that we have been able to get in front of, and once we get that opportunity, we tell the same story that we've told here today. We're able to very articulately and clearly demonstrate a need that is impacting young children and their families across Fairfield County that needs to be eradicated. It really needs to go away so children can be raised healthy and safe, and we want to use this platform as one of the ways to get that work done. So our fundraising road shows are available and ongoing, and we have gotten a lot of positive reactions and interactions from interested parties across time. In the beginning, it was a little slow and we had to get the word out, but I think since then we have picked up a lot of momentum and interest, hence this webinar, and we are excited about next steps and excited to engage in anyone else who'd like to learn more about this pilot and this process and the direction that we'd like to go in, and anyone who's excited about being a part of this change and willing to give to this movement.
Thank you. It was very helpful for everyone on the line. We had some great questions, so I appreciate everyone taking the time out of your day to go ahead and submit those and really show some active listening and some very insightful questions and inquiries. But to wrap up, we just want to invite you to follow ABCD's, both their website and I believe their Twitter link, and Chapin Hall in the connection as well. And of course, Fairfield County's Community Foundation can be found on Facebook. You can see the link on the slide in front of you. Please be on the lookout for our next Community Conversations webinar in November. Stay tuned for a specified date. And thank you all again for joining today's Community Conversation webinar. Have a great afternoon.